Thank you for inviting me. Kaszak asked a really important question. What is wrong with Illinois? Now, having been someone who ran for Congress against Broadband, I would be happy to engage anyone in a very lengthy discussion on what is wrong with Illinois. 3 years ago, the University of Illinois asked me to look into what can be done to help advance telehealth in Illinois. And my immediate reaction is, tele what? And I did some studying and I found out that, first of all, I have no background in healthcare, and as you can tell, I have no background in technology. But I did receive some awards from the Hospital Association when I was in the Illinois legislature, and I served on the board of a hospital for a number of years. So in answering the question of how to move telehealth forward in the state of Illinois, I went around the country for the last 3 years talking to wonderful, wonderful leaders throughout the country who spent an incredible amount of time, I can't believe how much time they spent with me, telling me about their programs and what they did to advance telehealth in their communities. And I was just blown away by the potential of telehealth. I'd like to tell you what I learned and what I think it will take to help move telehealth mainstream. So here's what I've learned. Number one, I learned that the telehealth environment is extraordinarily complex. And that's why I find it so fascinating, because it involves everything from culture to economics, from medicine to law, from politics to technology. Number two, I learned that telehealth is evolving in a rapidly changing healthcare environment. There's going to be 32 million more people entering the system within the next year. It's an aging population. The number of elderly will double in the next 17 years, causing a sharply higher demand for doctors. There's a doctor shortage. In 12 years, it is projected that the United States will be short of 130,000 doctors. Number three, telehealth can really make a difference. The efficiencies of connecting providers to patients through telecommunications can improve access, can increase the quality of care, and can lower costs. Now, there's somebody who should be on this next slide here. Oh, a little behind. Kaszak should be on this list of pictures. I had a chance of talking to these wonderful people around the country who have taught me much about telehealth. And it's a very, very diverse group of people. It's people from Kentucky, from Washington, D.C., from South Carolina, Arizona, California to New Mexico. Very, very diverse backgrounds. Some are MBAs, some are lawyers, some are government administrators, some are doctors, some are psychologists, some are nurses. But what I learned is that telehealth is really being powered by two things: telecommunications and medicine. And it is doing it at record speed. Last year, the California Healthcare Foundation predicted the global telehealth market would double in the next 13 years. In January of this year, a market research firm predicted that in the United States, telehealth usage would increase 6-fold in the next 4 years.